Respiratory.
How's it going?
Hi, Mr. Foster. My name's Tori, and I'm part of the respiratory care program. And I'm going to be helping you administer some breathing treatments today. Is that okay?
Yes.
Okay, your doctor has prescribed a few different treatments for you. So I'm going to show you how to use those and kind of explain what they're doing, okay?
Okay.
Alright, so before we get started, I need to just go ahead and take a listen to your breath sounds. So I'm going to have you sit up nice and tall and take deep breaths. And we'll just get a listen here. Go ahead and take some nice deep breaths for me. Okay. I just need to go ahead and get a pulse here. Okay. All right. So can you just go ahead and verify your full name and birth date for me?
Austin Foster, 12/23 of 94.
Okay. All right. Very good. Okay. So today it looks like your doctor's prescribed for you 3 different types of medications to help you breathe better. The first thing is albuterol, and we're going to be taking that through a nebulizer treatment. Have you ever used a nebulizer treatment in the past?
No.
Okay. So I'm just going to go ahead and show you how that works, kind of explain what's going on, and then I'll also teach you how to administer the other 2 medications, okay?
Okay.
So this albuterol that we're going to administer today in the nebulizer looks like this. And you can just go ahead and put the medication right in here through the top.
Okay.
And then this just kind of pops on like so. You want to make sure that this is plugged into the air compressor or it won't work.
Okay.
And it also needs to be plugged into the wall. Okay. So when it's working, you're going to see a nice fine mist coming out both ends here.
Mm-hmm.
And then when the treatment's done, it's going to sputter. And so that's how you know that the treatment is over. One thing to note though is that it'll still look like there's a little medication in here. You can just kind of tap it, and that will help get the rest of that out of there. Also, with this nebulizer treatment that you'll be taking, you need to just wrap your lips tightly around the mouthpiece here, and you're going to breathe normally. And then every 3 to 5 breaths, you're just going to take a nice deep breath, and then continue that normal breathing. Okay? Do you have any questions about this so far?
Nope.
It'll take about 5 to 7 minutes. Okay? So I'll go ahead and have you do that. And just go ahead and wrap your lips around there. Perfect. And just go ahead and breathe normally. Very good. And that deep breath occasionally just helps it get deep down into the lungs. Well, we hear it sputtering, so we know it's all done. Good work. Go ahead and take a deep breath in and cough for me. Okay, very good. Do you have any questions about how to take this medication through the nebulizer?
Nope.
No? Okay, great. Okay, so then the next medication that we're going to take today is Spiriva. Spiriva is a dry powder inhaler, and this is also a bronchodilator, just like the albuterol. What that does is it just opens up those airways for you. But albuterol acts more quickly than Spiriva does. Spiriva is going to last longer. So with this Spiriva, we're just taking it one time a day, and it's just going to continue to have that work and keep those airways open for you. So with Spiriva, it's a dry powder inhaler, and it looks like this. So to use this, you're just going to go ahead and slide back the cover here, and it exposes the mouthpiece. With the dry powder inhaler, the way that you're going to use this is you're going to turn your head to the side and take a really deep breath out, as deep as you can. You want to get all that air out. And you don't want to breathe out into the mouthpiece, because if you do, there's powder inside of here, and it's going to get clumped up, and you're not going to get the full dose. Okay? So go ahead and you'll take a deep breath out. Okay? Go ahead and wrap your lips around there tightly, and take a deep breath in, and hold it. Okay? About 10 seconds. Keep that held in there. Good work. Okay. And go ahead and breathe out. Good. Okay. So we'll just do that once. Oops. We'll just do that once daily. And if you see right here, this is called a dose counter.
Okay.
And this is going to tell you how many doses you have left. So that way you know when it's time to call the pharmacy and get it refilled. Okay? All right, I'm going to have you take another deep breath in for me. And cough. Okay. Do you have any questions for me about how you take this medication?
No, ma'am.
No. Okay. The last medication that your doctor's ordered for you is called Aerospan. This is a corticosteroid, and so what a corticosteroid does is it's going to reduce any inflammation you have in the airways, and that's going to help you to breathe better as well. So with Aerospan, you're going to take 2 puffs 2 times daily. So to take this medication, the first thing you need to make sure you do is shake it really well. And then if it's been a little while since you've taken this last, just go ahead and dispense 1 dose into the air. That way you know you're going to get the full dose when you inhale, okay? So you'll go ahead and shake it really well. And then you're going to put your mouth tightly around this mouthpiece here. And as you breathe in, you're going to push down on the canister. You're going to hold that breath about 10 seconds, and you can breathe out. And then we're going to wait about 30 seconds and repeat the process. We'll start with shaking it again for the second round, okay?
Okay.
This one you don't have to worry about breathing back into the canister. It's not an issue with this kind, just with the Spiriva.
Okay.
So we'll go ahead and take that now. Go ahead and give that a nice good shake. Great. Then you can just wrap your lips around that mouthpiece and breathe in and click. All right, very good. Hold that breath and exhale. Okay, we're going to wait just a little bit here, and then we'll just go ahead and do that again, okay? So this one's a little bit easier to use, and it's quick. It's fast. So we'll go ahead and do that one more time. Shake it up, good, very good. All right. Excellent, and hold it. All right, go ahead and, perfect. Now, I need you to take a deep breath in and cough again. Okay. Now, this is a corticosteroid, and so when you use a corticosteroid, you always need to rinse your mouth after you use this. So go ahead and rinse that, kind of swish it around and spit that out. That's going to prevent any thrush from building up in your mouth. That's something we don't want to have happen, okay? All right. So I'm going to go ahead and take another listen to your breath sounds. I want to see if these medications are helping. Okay. All right. So have you go ahead and sit up nice and tall for me again, and you're just going to take nice deep breaths. Okay. Very good. Go ahead and get those vitals here one last time. Okay. All right. Okay, so Mr. Foster, with these medications, there are some adverse side effects that I just need to mention to you. Things for you to look for, and if they cause you any trouble, please, contact your physician, and he can kind of explain to you in a little more detail. If you experience any headaches, nausea, dizziness, dry mouth, you'll probably experience a little bit of those things. Those are a little bit more minor, but you might experience your heart is racing, or you might have some eye pain, things like that. You need to make sure that your doctor's aware of. Okay. Do you have any questions for me about how to take these medications?
No, ma'am.
Okay. I'm going to go ahead and give you this call light here. You can use this anytime you need it.
Okay.
Okay. I'm going to be back to see you in about 4 hours for that albuterol again.
All right.
Okay?
Thank you.
Thank you very much.